Butler, and I am your moderator tonight. I want everybody to know I am not here in my official city capacity. I am here as somebody who wants to have some really solid conversation about some really tough things that are happening in our world, and that is women's health choices in Wisconsin. Let's talk. So our co-hosts this evening are the AAUW, the Janesville branch, the Diversity Action Team of Rock County, the League of Women Voters of Janesville, and the YWCA of Rock County. So we're glad you're here. We welcome your participation. You were given index cards when you came in, and so I hope that you are here to participate with questions because I only have 3 for them. So this will either go really fast or you'll just hold up. I've got some people on the side there. If you hold up your card, they'll come and collect it, and we'll get it into the roll as quickly as possible. So I want to talk about the panelists tonight, and we've got 3 very versed people in the field here, and I'm going to start with Carissa Lopez in the middle. She is the Executive Director of the Pregnancy Helpline and Resource Center of Janesville. Carissa's a native Rock County resident and a single parent, raised 4 children here. She has 2 bachelor's degrees in criminal justice and nursing. She's currently the Executive Director of the Pregnancy Helpline and Resource Center of Janesville, Inc. She's been serving in this role for about 2 years, and prior to becoming the director, she was a volunteer for a nonprofit agency for more than 16 years, primarily assisting with their post-abortion retreats for women and men who find they are unable to cope well after abortion. Dr. Jill Cugino, and I practiced even. Dr. Jill Cugino is an OBGYN at Mercy Health. Jill is a board-certified obstetrician and gynecologist. She's been in full-time clinical practice in Janesville for the last 11 years. Jill obtained her osteopathic medical degree from Ohio University and did her residency training at Mercy St. Vincent Medical Center in Toledo, Ohio. She's a mom of 3, a wife, a soccer coach, and a triathlete. Sarah Finger is the founder and executive director of Wisconsin Alliance for Women's Health. Since 2004, Sarah has been a leader in the effort to ensure policy and system change were created with us and not to us. She received her undergraduate degree in political science from the UW Eau Claire. In 2010, she received the Champion of Women's Health Award from the Wisconsin Women's Health Foundation. Among her many awards of recognition in 2012, she was named a Champion of Change by the White House for her work related to the Affordable Care Act. Sarah is a wife and a mother of 2. So we're grateful for your willingness to share your knowledge and insights with us and come together to learn about this important issue facing women in the community. So being in a difficult conversation, we're going to set some ground rules. So the ground rules are for respectful conversation that we're going to have this evening. And after that, then I'm just going to share a little story with you to kind of explain why we need these ground rules. So we will speak respectfully and listen actively and humbly and avoid mentally imposing our own biases, thoughts, and opinions on what someone else is sharing. We will be aware of privilege and power by thinking about how our identity and status affect how we speak and listen to others. We will speak from our own experience and avoid generalizing. We will respect that others' experience and expertise will differ from our own. We will refrain from personal attacks or comments on individuals. That does include politicians. We will commit to learning, not debating, commenting to share information, not to persuade. We will be patient with individuals' unfamiliarity with specific issues. So by hearing these ground rules, you probably are hearing that, we're not going to pave any new roads tonight. But hopefully by the time you leave, you've heard and learned some new things. You've expanded the information that you have to be equipped to create your own personal decisions. We speak from our own experience and avoid generalizing in one of the rules, and I'm going to make myself a little vulnerable and tell you why I felt like maybe I might make a good moderator. Because I'm not way over here and I'm not way over there, and I would imagine I stand with a whole lot of people in not being in one camp or the other. I've been married 35 years. I raised 2 sons with my high school sweetheart, and we lost our first child to a miscarriage. And that was heartbreaking for us. That doesn't, to me, make that any different from somebody who's having to make a decision to not be able to have a child. But I have that personal experience of knowing what that loss feels like. I guess I always thought that, it's just none of my business. And I probably should just not take up the conversation. I mean, everything's going fine for the world, right? Well, my grandmother and I were very, very close. I spent almost every summer with her on the farm. As soon as school was out, I couldn't wait to get in the van and be hauled down to southern Iowa where I'd get to spend the summer on the farm. And in her last 2 weeks of life, I was able to spend just her and I, and a couple times a day a hospice nurse to come in. And what I didn't know was she was going to tell me her entire life story. And I wish I could write faster. I wish I had recorders. Some of the things that she told me were just unreal. I mean, the fact that they didn't have indoor plumbing until 1943 makes me think, how did they do it? They were hard-working farmers. Grandma and Grandpa started together early. They raised 4 children. They lost 1 at birth. But what my grandma told me that has kind of scarred my memory for a long time is that she didn't have access to women's health care. And she found herself pregnant a lot of times when she didn't want to be pregnant. And she decided to share with me that she terminated her own pregnancies because there was nowhere to go. And so when I think about both sides of the situation of being a Christian woman who wants to, be a good person and value life, I also understand this need to have options and care. So no matter where you stand in this room tonight, your experience is where you'll be coming from, and I'm hoping that you leave here feeling equipped to share your experiences, to help them be understood, all the way to the state of Wisconsin, all the way to Washington, D.C., where your needs are being shared, and our lawmakers are hearing that. So, and I'm not asking you to do that on either side. It's going to be the side that you decide is the right side to share. So, panelists, are you ready? Thank you for letting me share that, by the way. The first question is, from your perspective, and we'll start here with you, Sarah, what will be the impact of the reversing Roe v. Wade on women, families, and families in this community and communities across Wisconsin? We're going to talk solely about Wisconsin tonight.
Well, first of all, thank you for having me. Thank you for the amazing turnout tonight. I think we got more than 50, and I did not bring enough handouts, so I promise those of you who still want some, I'll provide them. A little bit more about my organization. In 2004, we started this organization with a vision that when we're on the cover of Time magazine and we've all, accomplished it all, is that every single woman in the state of Wisconsin at every age and every stage of life is able to reach her optimal health, safety, and economic security. And at the heart of what we're doing is really trying to make sure that policy and decisions impacting women's health, safety, and economic security are happening with us as women rather than to us. And unfortunately, what we've seen over the last decade especially is that women have been on the menu instead of somewhere in that policy-making kitchen informing a lot of these policies and decisions. Right now in our state legislature, only 1/3 identify as women. So there's big decisions being made, right? And unfortunately, a lot of us just aren't given, the support to necessarily help inform some of these really big decisions that are impacting our health, our safety, and our economic security. So for the last 18 years, I've been working in this space, and I've been really working to help individuals be informed, be involved, and inspired to be advocates for change. And I hope it's not lost on any of you that is a critical women's health and reproductive health, and economic security and safety issue. Reproductive rights and access to abortion has been at the front of what we have been focused on for the last 18 years. And our organization is based on evidence, is based on science, and is really based on valuing, centering the voices of those impacted by these policies. So, to your point, I'm devastated. I am upset. I am not surprised. We saw this coming. I was mentioning earlier to someone else in the room, people all over the place now are asking me, what do we do, Sarah? What do we do? What do we do about what's happening right now? And I have a whole story about how we need to rent a DeLorean and go back in time. But I right now we're still, I mean, there's so much that we are unraveling. And the truth is we've known since the Trump appointees to the Supreme Court that this was going to happen. So for those of us who are in the trenches, we knew this was coming, but it doesn't mean it didn't hurt like hell last Friday. And it doesn't mean it doesn't still shock us. And we are right now really trying to recognize what I think are the unintended consequences of this political agenda. Our organization has also recognized the maternal child health disparities that exist in our state, that we are the worst in the nation when it comes to the disparities around maternal child health. The worst in the nation for black moms who are dying 5 times the rate of white moms in pregnancy, and black babies are dying 3 times the rate of white babies. So we have already a maternal child health crisis in our state. And now we're talking about forcing pregnancy on individuals who are already vulnerable when pregnant. And we are starting to hear all sorts of stories. This has only been, not even a week, right? This has only been a handful of days, and I'm hearing stories from my friends at the Department of Health Services, friends in the AAUW, the obstetricians and gynecologists, the State Medical Society. There are going to be so many consequences and so many systems we're going to have to put in place to recognize this new level of crisis. And when we're talking about people being forced to go through with pregnancies, we're going to have to figure out in NICUs right now, in the neonatal intensive care units, we're going to have to figure out what hospice looks like for women that are forced to carry their baby to term and deliver them when they are going to die within a certain amount of time, and the mental health implications of that. We are going to have to recognize that there are going to be individuals who are going to seek self-managed abortions because of desperation at this point. And how are the hospitals and the clinics and others going to be able to train up in time to help treat these women who are going through, whether a miscarriage, whether a self-induced termination of a pregnancy, or again dealing with a pregnancy that has a fetal demise that's being forced to carry that pregnancy all the way to term. And we have got to figure out how, more than ever, we have got to figure out the policies that are actually going to support these babies and these moms once the umbilical cord is cut. Because right now, with the kind of maternal and child health disparities we have in our state, we need to extend postpartum Medicaid coverage in our state from, currently it's only 60 days. Now, I don't know how many of you have been pregnant, but my body didn't magically fix itself after 60 days of postpartum. So right now in Wisconsin, Medicaid only offers 60 days postpartum Medicaid coverage, and they just applied to get an extension to 90 days. Well, best practice says it should be 1 full year postpartum for the mom and the baby. We couldn't get that passed this last session. We have bills that talk about providing mental health care for a lot of women who are going through postpartum depression. We have bills that are trying to ban the shackling of pregnant and laboring people in prisons, right? Like, there are all these things that we know would improve maternal child health that are not being taken up. So at this moment of crisis, we really have to dig deep and figure out how far does our commitment go to the moms and babies in this state, and what are we going to do politically, socially, individually to make sure we don't shy away from this conversation and the realities of what this moment means. So that was like 3 questions answered in one. I'm excited to be here. I'm obviously very passionate and very emotional about this issue. I have a 12-year-old daughter, and the idea of her, God forbid, being sexually assaulted and being forced to carry a pregnancy from her attacker is haunting me every single day. So I'll turn it over to you.
Thank you.
Yep.
Carissa?
Well, thank you for inviting me to be here. I'm going to talk about this question on a little different angle because I am the director of a pregnancy helpline and resource center here in Janesville. So my perspective is just slightly different. We're non-medical, we're a non-profit organization that's been providing services to men and women and families in this area since June of 1983.
Try to speak just a little louder for them in the back.
Sorry. I don't anticipate any of our services changing. Currently, for families struggling to make ends meet, who might be in need of social support, educational support for parenting, we offer parenting classes. They're earn while you learn, so you take the parenting class, you earn credit to purchase everything in our store, which is typically brand new items, so everything from prenatal all the way through age 2. And for the folks who come to us and they can't come to care classes because maybe they don't have transportation, maybe they don't have a babysitter. Well, they can utilize our emergency area, which you can get those same things gently used up until age 2. And we really try hard to get these folks connected with the local resources that they might be in need of. For the people who travel out of state to have abortions soon, we offer a Rachel's Vineyard retreat for those folks who maybe in hindsight think maybe that wasn't the best choice for them and they're having a hard time coping. We'll continue to offer those retreats. And lastly, we have a national helpline, which we get calls from all over the nation, from people who have questions about pregnancy. And we try to connect them with their local resources nearby them. So within the scope of our mission, which is to advocate for life, faith, and family, we don't anticipate changing any of what we offer. But that being said, I don't think we can predict the impact of what the Supreme Court has decided, and our organization will certainly adapt as needed.
Thank you. Will you pass that down to Dr. Jill, please?
Well, it's so nice to be here. Thank you so much for inviting me. I'm so happy to be able to be here and share my expertise in this area. As you know, I'm an obstetrician and gynecologist, and I am in clinical practice, and so I've delivered somewhere between 1,500 and 2,000 babies in my life. And in that process, I have helped women both with their decision to continue pregnancy and their decision to not continue pregnancy. And so I feel like I come from a space of some deep understanding in this area. In Wisconsin, right now, any interruption of a pregnancy is illegal. It is illegal for someone to interrupt a pregnancy. And the onus actually, according to this law, which was enacted in 1848 or 49, something like that, this was of course before ultrasound. This was before any real ability to date pregnancy or understand viability until a baby was born alive or not alive. And so this law currently, as it stands, criminalizes providers. It is a felony charge for a provider to interrupt a pregnancy unless the mother's life is in imminent danger. There's no provision for whether or not the current pregnancy in question is viable, meaning if a woman is having a miscarriage, a non-viable pregnancy, and unless her life is in imminent danger, i.e. she's hemorrhaging or she's actively infected, we're not supposed to do anything. And the immediate impact of this is that women are already, in 5 days, being denied care for their non-viable pregnancies. They're being forced, in some situations, to continue that pregnancy until their life is in imminent danger. Thankfully, this law penalizes physicians. It's mostly physicians who do this work, although midwives and nurse practitioners are also involved. And so we come with an army of attorneys, right? And so in a lot of ways, I'm thankful that our current law is for physicians, because we're pretty well protected. We're a well-connected, well-resourced group of people. But it is going to result in inadequate, unsafe, and dangerous care for women. 20% of pregnancies will end in miscarriage. 20%. 1 in 5 pregnancies end in miscarriage. This does not include termination of pregnancy. This is normal physiology. And so 1 in 5 women pregnant at any given time are going to be exposed to this. And in many cases, women, our bodies are brilliant and wonderful and beautiful, and they do what needs to be done on its own. But sometimes that process is incomplete, and sometimes it doesn't happen before there's hemorrhaging or there's infection. And when it gets to that point, it is dangerous and scary. Women lose their uteruses. They can require blood transfusions, and even death. There's also no provision for if the pregnancy is inside the woman's body, but not inside the woman's uterus. And so an ectopic pregnancy that's not actively ruptured could be considered non-life-threatening in this very moment. And some providers will take this law to say, sorry, go home. Come back when your pain is worse, or when you're having chest pain or shortness of breath and you're bleeding internally. So that's not abortion related, right? That's the impact of this law in this moment for all pregnant women in the first trimester. Of course, as far in terms of termination of pregnancy, in a termination in terms of abortion of a pregnancy that's either not known whether it's viable or known to be viable, but the woman desires not to continue on in that pregnancy, this ban will have very little effect on well-resourced, high-income women, right? Because thankfully, abortion will likely never become illegal in Illinois, and will most likely never become illegal in Minnesota, and so there's no current ban in Wisconsin that would prevent women from traveling to get those services. And I am at this point still allowed to counsel them about how to obtain those. For tech-savvy women who are internet savvy, there will be, I'm sure there already are, hundreds of websites that you can go to get abortion pills shipped to you. Yes, I will make lots of copies of that for my girl. They will be able to get what they need. And the wealthy will be able to travel when they're beyond, if they find out that they're pregnant, beyond the time frame, about 12 weeks, for pill abortion. But it will be low income, low resourced, more commonly indigenous and women of color who will be disproportionately affected by this ban. They will not, less likely to be able to travel out of state, and with the cost associated with that. And this will result in forced continuation and forced birth in women who are already struggling to provide for themselves. 60% of women who choose to terminate their pregnancy are already mothers. And so in the vast majority of those cases, the women make the choice to terminate their pregnancy so that they can better care for themselves and the children that they're already mothering. Those women will have a much harder time of traveling because of the care for their small children, which we know, and I'll probably get into this some in a little bit, but there's actually a very good study that was published in 2016 that shows that women who are denied abortion, who desire abortion but who are denied abortion, their life is worse than women who are able to get an abortion. They have higher rates of depression, higher rates of anxiety, they're more likely to be low socioeconomic status. Their children don't do as well as the children of women who were given an abortion when they sought one. And so truly it is going to continue to impact a group in our society that is already over-impacted. in a country that provides no paternal or maternal leave, no guaranteed paid leave after a child is born, that has no universal child care, that has tries all the time to cut food benefits, Medicaid benefits, to force birth on a group that is already disproportionately affected by these policies is unacceptable, in my opinion.
Dr. Jill, hold the microphone for a moment. I think you've covered a lot of this question, but I pulled it because it speaks directly to what you were saying. It says, to Dr. Jill, if a woman has a pregnancy that is too early for viability and she goes into DIC, will hysterectomy or other life-saving measures be off the table? What about ectopic, malignant preeclampsia? Will women have options in some states where health of women not accounted for? How concerned are OBs in Wisconsin?
Today, my partners and I have shared at least 100 text messages, 20 emails, and several phone calls because we are scared. We're scared. We're scared for our patients. We're putting the policies in place so that we can care for them. We're a little bit scared for ourselves, right? A felony charge sounds horrible, but we know we'll fight it. And at this current moment, in our current political climate, I don't think that prosecution would be undertaken. Certainly not at the state level. But in our local jurisdiction, it absolutely could be, and we can't rely on that. Yes, there have already been cases of women who have a known non-viable pregnancy being denied a D&C. There's very good criteria. We have very good criteria. We're very good at ultrasound. We know by 7 weeks if a pregnancy is going to be viable or not viable, right? So, but sometimes it takes 12 or 15 weeks from that moment for the body to recognize that this pregnancy is non-viable. So that's a long time for women to have to wait, to wait to move on, but also time to risk infection and hemorrhage. And so yes, already in the 6 days since this has happened, there have been documented cases of women being denied medical care because of fear of repercussions from this law.
Carissa, I'm going to have you take the next question. I have two that kind of direct to you. The first question is, how many clients do you actually see and provide for currently?
Last month we saw our biggest hike due to the formula shortage, and we saw 60 new clients, and that's not including the people who had been there previously. So typically we average around 100 clients. Our care classes are averaging between 17 and 20 clients, like families, a week.
So Planned Parenthood has had funding cuts with abortion outlawed and a lack of resources. How can they provide services such as birth control, testing for STDs, etc., under the new situation you're in?
How can they provide it, or how can Planned Parenthood provide it?
Planned Parenthood, the question, and maybe the person asking it wants to clarify, Planned Parenthood has had funding cuts. With abortion outlawed and a lack of resources, how will you continue to provide services such as birth control, testing for STDs, things like that?
We won't, because we're non-medical.
Well, and I did provide I don't know if everyone got one, a brochure, kind of raising awareness about these fake centers that are not medical, that will not provide referrals for birth control to plan or prevent the next pregnancy, will not necessarily, again, advocate for the kind of policies like paid leave and some of those things. So in terms of Planned Parenthood, in that same brochure, it talks about a licensed family planning clinic, which we should be very clear, there are Title X and Title V family clinics in the state that are not allowed, any federal money, any of those funds are not allowed to go towards abortion services. So even though there's like 80 of these fake crisis pregnancy centers in the state, there's only 20-some family planning clinics, and there was only 4 abortion clinics before it just got outlawed last Friday. So what you all need to know is that the family planning clinics, whether it's Planned Parenthood or it's a local, I believe, help me, Sue. First Choice, thank you. So First Choice is going to be a Title X clinic. Anybody that's a licensed Title X, Title V clinic will offer same kind of services in terms of pregnancy testing, STI testing, pap smears, and making sure that they are triaged, so individuals, again, who are faced with an unintended pregnancy, to get to the kind of care they need based on their, again, their choices between their faith, their family, their physician. And so I, again, would really lift up that even though we know now that there are no abortions being provided in Wisconsin, there are family planning licensed, legitimate family planning clinics. They've been shut down, like someone mentioned, they've been defunded and they've been attacked, but they're still there right now to help individuals who are in this place of crisis. And obviously the OBGYNs and the professional medical associations, or professional medical institutions are there to, in a scientific, evidence-based, non-judgmental way, help treat individuals seeking care right now.
Thank you for covering that question. I'm sorry, Carissa, for plugging you that way. That was my big faux pas for the night. What do you need from your local elected officials?
So first we need clarification on this law and what it means. Because nobody knows. It was written like 170 years ago or something. Like, I mean,
1849.
1849, right.
Before there was running water in your grandma's house.
That's right. When the state
Right.
was 1 year old.
Yeah, exactly. So we just don't know what this law really means. Secondly, we need protection for our patients. We need family leave. We need expanded Medicaid. We need more money for family planning services. We need better access to contraception. We need actual sex education in schools. I mean, the list could go on and on. We need childcare. We need better pre-K. So many things. We need so many things. But first and foremost, we need to know what this law really means. Who is going to be prosecuted? When are they going to be prosecuted? And then we can work from there.
Carissa, does the Pregnancy Helpline have any needs from their elected officials?
So because we're a nonprofit organization, we don't get any money from the government. It's strictly individual grants, private grants, and individual donors.
And how about you, Sarah? Do you have anything of what do you need from your elected officials?
So again, let's go back to the DeLorean. This is all by design. This is exactly what was put in place since 1973. I look back at the 2010 midterm election and how people just took that whole election for granted, and dynamics changed drastically in state legislatures all across the country. So right now we know I'll get to the point of what we need to ask our state legislators, but my greatest concern is that we estimate less than 7% of people in our state can identify who their state legislators are.
Say that again.
7% of people, let's reverse that, 93% of people in the state are not likely to identify who their state, so we're talking about their state legislature, not Congress, not US Senate, their state assembly person and their state senator. So we're talking about what we need from them. Well, first we need to know who they are, right? And then we need to know what they're doing on our behalf. So if you're not necessarily knowing who your state legislators are, you don't know how they're acting on your behalf, and organizations like ours are trying to show transparency and already existing public record about which state legislators sponsored which bills, like paid leave, like affordable child care, like not shackling pregnant and laboring people in prisons. We are trying to help bring that to the individual because we have for too long taken the state legislature for granted. And I just want to make a note that, I love how we're just Dr. Jill. I feel like you should be like in a podcast. I think, right now we're talking about what's happening in Minnesota and Illinois, and they're safe sanctuary states. But the current one, we need to understand the 1849 law that had multiple opportunities to be repealed and wouldn't be. And not only did they not repeal that law this last legislative session, but they also proposed to do things like in Texas with a bounty. So not just outlaw abortion altogether, but basically put a $10,000 bounty for the Uber driver or a partner or a person, outside of a clinic. So I don't know what November 8th is going to bring. I don't know what November 9th is going to bring. But I'm just going to tell you, it could get way worse. And what's happening in other states, too, is this digital security. Back before abortion was legal in 1973, there was the Jane Collective. There was this underground network of people trying to help individuals in need. Well, now there is a lot of resources being made available, but we are not guaranteed to have our digital privacy secured. And there are proposals in a lot of states right now to track Wisconsin women or women in states where abortion is banned on where they go outside of Wisconsin and still prosecute them for going over state lines. So, if it's not scary right now, it could get even more terrifying. So I'll put it that way. So in terms of our state legislators, we just need to absolutely connect with them, and we need to absolutely insist that if we are going to create this level of crisis that we've never seen before, that we better at all political persuasions get on board and do what it takes to support that mom and that baby once that umbilical cord is cut. Because if I hear another thing about personhood and supporting that zygote and then doing nothing to support these babies that are dying before the first year of their life because of infant mortality crisis, or these moms that are struggling, nope, not gonna have it. If you can't tell, how did you know when you organized this that it would come down a week before? It still could have been a leaked opinion, but now it's real, folks.
We didn't. I've been sweating for a week. And again, I'm not sure if there's anybody on the panel that can answer this question. If you feel like addressing it, I'll pass the microphone. It says, what plans are being made by Illinois abortion providers to care for Wisconsin women? Have any of you been contacted or able to speak on that?
I understand that there's a clinic planned for South Beloit. I don't know when exactly, but they're ramping up. They're getting ready to help our residents, thank God. But until then, women will have to travel almost all the way to Chicago to get care from our area.
Well, and I just want to point out, it's not just Wisconsin women that are going to Illinois. Think about how many other surrounding states have now outlawed, because as soon as they reversed Roe last week, they had trigger laws or zombie laws like ours that went into effect. So Illinois doesn't just have to figure out how to take on the patient load from Wisconsin. Iowa, Ohio, Missouri, Indiana, Mississippi. For in some cases, that's as far, where you can go as the closest place.
From Mississippi, the closest place will be Southern Illinois.
And someone just said the price of gas. So if you're looking to support individuals right now, supporting to women's medical funds who are offering the kind of support for travel, for paid time off, for childcare and some of these things, this is where we need to rally and provide that kind of care network for women in need right now.
So the group that kind of set this up, one of our questions is curious, and I wish we had a law enforcement person in the room that could help us understand this, because how will this law going back to 1849 criminalizing abortions affect all women? And I can't help but think of my miscarriage. I can't imagine being a woman today, June 30th, 2022, miscarrying at 21 weeks, and being afraid to see your doctor because could you be criminalized? could you be accused of not naturally losing that baby? And I don't know if there's anybody from a legal aspect in the room that can speak to that, but that's a question of right now that we were kind of hoping to learn about, and then, but the decision came down. So any comments on that?
I maybe can speak to it a little bit. So again, we're still seeking clarification on the law and what that really means for us. But the way we read it, by we I'm referring to Mercy Health Obstetricians and Gynecology Group, we read it as that women are not the ones who are prosecutable under this law. It is a provider interrupting a pregnancy. So if a woman seeks an abortion out of state, currently under this current law, that is legal, as well as obtaining abortion pills online or in any other way, would currently be not prosecutable. It would be if I provided an abortion for a patient, if I terminated a pregnancy for a patient on their behalf. So prescribe the pills, do the procedure. That's the way it is understood currently. But that could change, of course, at any given moment.
And again, there's a lot of different laws in a lot of different states right now. And in states like Texas, you saw a woman who had miscarried who was prosecuted for suspicion of a self-termination. So that's, like you said, there are so many gray lines right now. And I think if anything, even if we don't know right now, I mean, it's got a real freezing effect in terms of scaring people off from doing anything and getting maybe the care and information they need.
100%. 100%.
So this card has two questions to it. It seems everything now is being called abortion. It used to be a D&C when there was a miscarriage or a procedure of ectopic. Is it truly abortion then, or is that fear-mongering? And then the second was the Supreme Court, they sent the decision down to the individual states versus ending abortion, true or false.
Oh, sorry, I missed that.
I could answer that one.
Okay,
You can answer
okay,
that.
yeah.
All right, you answer number 2 and then pass it down.
Yeah, so the talking point right now from those that chose to reverse Roe is basically, we didn't make abortion illegal. We just didn't secure the right to it federally. We're going to leave it up to the states. And again, 2010, this was a very deliberate thing. States are very hostile, for the most part, to reproductive rights and justice. And so, yes, it's now left up to the states. But again, while I was talking earlier at the state legislative level, on November 8th, and upcoming elections at the federal level, if different people were in charge, they could pass an all-out federal abortion ban that would negate even the states like California and Illinois and New York who codified the right to abortion. And basically, again, it's not up to the states anymore. They take it back to that level and they make a federal law that says abortion is illegal across the state.
So the medical term for pregnancy loss before 20 weeks is abortion. It can be a spontaneous abortion, which is where your body expels the pregnancy on its own. It could be an elective abortion, which is where the woman seeks, the person with a uterus seeks to end the pregnancy, whether it's viable or not viable. An incomplete abortion is where part of the pregnancy has passed. And a missed abortion is where the pregnancy has ended, but the woman's body hasn't recognized it, and so it continues to be within her, in the uterus. Miscarriage is a lay term. It is not a medical term. So the term for losing a pregnancy before 20 weeks is abortion.
Well, that's a nugget I'm taking home as learned tonight, because I did not know that. So, some of the questions have a little bit of an inflammatory edge, but I want to honor your questions. because I don't think it's fair for me to decide what's right and what's wrong. But, and if one of you wants to address this, feel free, but otherwise I'm going to just keep going. How is forcing a woman to carry a baby to term different from slavery?
I'm just gonna, that is not a question that any of us as white women can answer. I'm sorry. I'm not even gonna go there, but we have to stop, speaking for people of color that have experienced slavery.
Legally, has the Supreme Court ever overturned one of its own decisions?
First time in U.S. history that we have had a right revoked.
What will happen to Plan B? And do you see changes to access to birth control? This is going to take a while.
I'm going to hand this to Dr. Jill, but in the agreeing opinion from Supreme Court Justice Clarence Thomas, he talks about IUDs and birth control and anything related to our privacy. I mean, the fact that he laid it out there, he said the quiet part out loud. So we are bracing for those kind of restrictions and these kind of demonization and villainization of things like birth control.
So, I have goosebumps, and I hope I don't cry, because this is the part that really gets me. But first of all, Plan B is, for those of you who don't know, there are two forms of medication that we call Plan B. There's a branded Plan B, which is levonorgestrel, and there's Ella, which is ulipristal. And both are progestins that are given within 72 hours of unprotected intercourse. They're intended to delay ovulation. They will not end a pregnancy. In fact, we give progestin to pregnant women all the time to help protect their pregnancy. So if you are pregnant with an implanted pregnancy, a Plan B, Ella will not disrupt that pregnancy. It is not an abortifacient. It is considered a contraceptive and will not interrupt a pregnancy. So under this law, and universally, while contraception is still legal, Plan B will still be legal. That being said, there is a lot of misconception amongst physicians, amongst pharmacists, who will refuse to prescribe those medications because their understanding is incorrect and that this is an abortifacient. It is not an abortifacient, and so you can continue to instruct your young people who have had a condom break, or they missed a pill and they had sex, or whatever, that they can get a Plan B and it is legal and it will not be considered an abortion. We are also bracing ourselves for the idea that contraception could be taken away from us, which I can't even begin to explain how terrible of a situation that would be for all humans with a uterus who don't desire a baby to be in them. It is reckless and dangerous and evil to even consider that it should go away. But for right now, young people, sexually active, reproductive aged, people with uteruses in their bodies, please encourage them to get to their OBGYN and get a Nexplanon or an intrauterine device, something that is in their body and will be there for several years to protect them for this upcoming, potentially very dark moment.
This isn't so much of a question, it's a clarification, and I think, Sarah, you stated it right, that it was the first time that we had rights revoked, but the Supreme Court decision, Plessy versus Ferguson, was overturned, but that expanded right rather than restricted rights. So whoever the book smart one in the room is, thank you for that. What services does the Pregnancy Helpline provide? Can you elaborate a little bit? Probably because of my bad question to you.
Well, I kind of went over this on my first answer, but we have care classes, which are for families struggling to make ends meet. So you can get everything that you need for your child from birth to birth to 2 and even in the prenatal period. So it's parenting classes, and they come and they can shop in the care room, earning credit to purchase all of those things in our care room. Then we have an emergency area for the folks who are unable to attend care. So maybe they have childcare issues, maybe they have transportation issues, but maybe they can stop in once a month. And so they can get all of the things that they'll need for their child from birth to 2 by just stopping in once a month, and we can try to connect them with other resources that we might not be able to provide for them. Then we have the Rachel's Vineyard retreats for folks who have had an abortion and maybe are having regrets from that abortion. Maybe they're suffering emotionally and they've reached out to us saying, I regretted my abortion and what can I do? And come join us on this weekend retreat. We have those twice a year. Finally, we have our Helpline, which we receive calls from all over the nation from people who are in need of resources, and we try to connect them with local resources.
The second part of that question, does Pregnancy Helpline help women with family planning in general?
We can do some counsel for that, but again, we're not medical, so when it comes to birth control, that's going to be a referral to a provider, a medical provider. We can do some education. We're not prescribing birth control or even really suggesting where to go for that.
This is a lot, and I want to be able to read this in a way that you'll be able to formulate some answers, because there's a lot of questions on this card. What's my future going to look like by your estimate? What is being put in place to protect me and my younger sister, a teenage transgender uterus owner? Is anyone working for protection for sexual assault, raped, molested people with uteruses if they get pregnant? I don't know that we have answers for this. I mean, it's a valid question. I wasn't going to put it to the panel because I don't expect you to have answers for it, but I think it's a valid question.
If I can. I often talk about these opportunities as gifts wrapped in poop. And I know this is on TV now, so yay, Sarah. That because of these kind of moments, it brings people together, I think, in beautiful ways that hadn't necessarily collaborated before. And so I'm watching the Wisconsin Coalition Against Sexual Assault really engage in this issue and really work with the sexual assault support networks all across the state. I'm watching Fair Wisconsin and Trans Health and organizations recognizing that there are a lot of individuals that are going to be disproportionately impacted. We talked about people of color, LGBTQ, rural women, indigenous, so we talked about all those groups, and I just want to assure you that I am on a daily calls with multiple coalitions, and those organizations representing trans health, representing trans kids, representing sexual and incest victims and survivors, they are very much in this fight. So I just want to reassure you of that, and I think it's going to take all of us. Like, we just can't leave it to the Wisconsin Coalition Against Sexual Assault to fight this. This is something we need to understand is going to intersect in so many different ways, and we all have to fight for the whole.
And just to put this idea out there, when we talk about exceptions for abortion for sexual assault, rape, and incest, that would require a victim of those things to disclose her victimization, to disclose her assault, and to disclose her pregnancy to the courts in order to get her abortion approved. Can you imagine having your health care be determined by a court that you then had to go accuse your brother or your father, if we're talking incest, or your friend who assaulted you? And you know, those things should be reported. But in that moment of absolute crisis, now you add that layer that you have to get the court and law enforcement to approve your abortion. Sorry, but that's evil.
And just to be clear, the 1849 law that's now in effect in Wisconsin does not have exceptions for rape or incest or the health of the mother. There are people all over the state saying, oh, it's not so bad. There's still exceptions for rape and incest. No. Those geniuses back in 1849 didn't think of those exceptions. But you have people running for governor right now who are talking about rape victims, young rape victims, as making lemonade out of lemons. And you are talking about organizations and state legislators right now who want to make it that much worse and even start challenging the health of the mother exception.
From the law standpoint too, there's a PowerPoint running in the back of the history of women in Wisconsin and across the U.S. and the history of abortion in America. And so there was a case, and it was Planned Parenthood versus Casey in 1992. And rather than overturn Roe v. Wade back then, the court reformulated it with something called the undue burden standard. That new decision allowed states to create new standards that can be taken to persuade women to carry a pregnancy to term, but states cannot prevent a woman from receiving an abortion. So states would then have the latitude to restrict abortion in more ways than under Roe, such as a waiting period, informed consent, etc. And then that pendulum swung back. So there was the Planned Parenthood versus Casey in 1992 was making some great stride, and then a pendulum swung in 1993 when Bill Clinton was elected president. But the purpose of that comment in this section is that there have been states having the ability to put some of these laws in place prior to this. It's not a matter of, well, we were just stuck with what happened in 1849. We now are stuck with a long history of do nothing, and now this time here is what puts us in such a tough position. So understanding that the focus be on the women's health, but also that Roe v. Wade was the case that many others things rested on, what is the likelihood of other rights soon being removed? And I think we touched on those again, but did you have things you wanted to add to that?
I mean, just so you know, this court, the way they approached this case, basically recognized that things can be rehashed, right? Like, a lot of these things that were set precedents could now be challenged. And so I have 8,000 emails in my inbox right now, and it's just too much. But I get a lot of different analysis and things, and the things that we took for granted, like interracial marriage, things like not having to ask your spouse to access birth control or get a credit card. This is not hyperbole, because when you open up this opportunity to go back and take something that was set law and precedence, you're giving permission for the Supreme Court to undo a lot of things. And if you look at what they're doing right now on guns, and if you look at what they're doing right now on climate change, they basically just gutted the EPA today to make it hard to fight, to mitigate climate change. I have no faith in them restraining themselves at this point.
Are one of you able to clarify the difference between the risk to the health of the mother and the risk to the life of the mother? Is there a difference there?
Doctor?
Yeah.
So to the life of the mother, 24 in 100,000 women die as a result of their pregnancy. 24 in 100,000 live births, the mother dies. In America. So that's the life of the mother. But there are a laundry list of medical conditions that are made worse and threaten the lifelong health of a woman. Women with cardiac disease, women with severe diabetes, women with neurological conditions. The list is very, very long of conditions that are lifelong altered by a pregnancy. And there are thousands of women a day who are told by their cardiologist, their rheumatologist, their neurologist that they should never get pregnant. And so we put these women on contraception, but nothing is perfect. 6 in 1,000 women with a tubal will get pregnant over the lifetime of that tubal. 1 in 100 women taking birth control pills get pregnant every year. 1 out of 100 get pregnant every year. So they're doing the thing that their doctor told them they should do to keep themselves healthy, and it fails. So then what? So, to me, that's the difference between the life and the health.
There was a handout that I didn't give enough of, talking about what are individuals going to do when diagnosed with cancer while pregnant. And if you want the microphone back after that, I'll just say that I myself have had 2 pregnancies, and I have a blood clotting disorder. I have a factor V blood clotting disorder that luckily I found out before I got pregnant, but it is often the cause of miscarriage in the placenta, or what am I supposed to call it now? We're all saying miscarriage, but getting a blood clot in the placenta and basically not allowing me to carry a pregnancy. But not only is it a threat to the fetus, but it's also a threat to me, right? Like I can get a blood clot and get a stroke. And so I remember when this was all being debated, pregnancy is a big deal, and there's another handout I put out that says pregnancy is much more dangerous than abortion. And so when I think about my pregnancies, and I think about how every single day I had to give myself injections so that I wouldn't have a stroke, so that I wouldn't miscarry and get a blood clot in my placenta, all these circumstances and not having that option to do what maybe a doctor would suggest and advise you to do to help save your health and your life. And then this whole idea too between the health of the mother, what about like future fertility too? So there's a lot of reasons why this has been a safe and legal option for individuals at any point in their pregnancy. But again, it's complicated. And so whether you are epileptic and you can't take a certain medication, and people, I'll let the doctor explain, but this is really going to cut off a lot of opportunities for individuals who not just have maybe a complicated pregnancy or even a straightforward pregnancy, but have an additional complicated health issue on top of it.
The data is very clear that abortion is safer than pregnancy. Very clear, unequivocal. It is not common for women to be diagnosed with cancer while they're pregnant. But when they are, if the baby is less than 20 weeks, it is often recommended that the woman terminate the pregnancy so that she can have her cancer treatment, so that she can either continue to parent and mother her current children, or get her treatment, get better, and then get pregnant. But that delay in treatment can absolutely affect her ability to continue on to mother the children that she already has. And another thing, kind of going back to the question about what other things are going to be impacted here, there is a lot of conversation in the infertility, reproductive endocrinology infertility world that this is going to affect them as well, right? You think about like conception as being this like very important thing. Well, in a lot of the infertility work that is done, conception is created right? It is produced and made in a test tube, and so there's a lot of concern that in some places infertility treatments will no longer be available or be legal.
So there's a couple of questions here that kind of go together. And I went back to my notes. One of them says, was the 1849 law in effect before birth control came into use in the 1960s?
Yeah.
Head shaking, yes.
Although they were doing birth control, right? Like there was methods of contraception, but there was not. Hormonal contraception was in the 60s, yeah.
And then it says there is a 1985 state law, and how does this fit in with the 1849 law? And I'm just going to read how that went down. So Wisconsin has a legislature that has gone back and forth pretty consistently. The background is Wisconsin has allowed most abortions until the 22nd week of pregnancy to save the health of the life of the mother. A woman seeking an abortion must meet with a counselor and doctor before obtaining an abortion and wait at least 24 hours before having it done. Anyone under the age of 18 must have an adult relative over age 25 with them to obtain an abortion. The effect of the Supreme Court ruling, now that Roe v. Wade has been overturned, it is presumed that a state law passed in 1849 making an abortion a felony offense would go into effect, and doctors have halted procedures. However, Wisconsin's Democratic Attorney General argues that the law is so old that it's unenforceable. The language allows a woman to legally destroy her own fetus or embryo and grants immunity if an abortion is needed to save a woman's life and if performed in a hospital. Another state law passed in 1985 prohibits abortions performed after a fetus reaches viability, when it could survive outside the womb, conflicting with the 1849 ban. So those two questions, as they go together, you're as confused as I am because they conflict with each other. And as it stands just a week old, the understanding is that we're back in 1849. So the question was, how does it fit in with the 1849? It doesn't.
So you're seeing a lot of conversation now about how to fight back, right? And so there are these lawsuits because right now, even after the 1985 law, in 2013, Wisconsin legislature passed a 20-week abortion ban. So there was this whole fight that happened. So even prior, even with Roe being legal, we had a 20-week abortion ban in Wisconsin. So I think part of the argument right now with the Attorney General is that you went ahead in 2013, I think, to pass a law recognizing legality of abortion but restricting it at 20 weeks. That's in conflict of the 1849 law that says no abortion is allowed. So I don't know what's going to land up. We have a very conservative state Supreme Court, where it will go to. So there are states that are trying to look at some of these nuances and see if there's any opportunity to challenge and maybe put a stay. But again, you're seeing every single abortion provider in the state of Wisconsin stop practicing because right now it's assumed you will get 5 years in prison and a $10,000 fine if you help with the termination of a pregnancy.
Again, another one I'm not necessarily going to throw at the panel, but an extremely good question that I've been up here pondering. Can you speak to the long-term life impact of abortion on the future of a father, the other partner, when it comes to, education, income, etc.? Just Dr. Jill is like, yep.
So the Turnaway Study, which is, I referenced it when I first started speaking, it's a 2016 study, it's a 10-year-long study, looked at 1,000 women and included their partners where that was available. And it has really great data. They followed them for 5 years after their termination or their denial of their termination. And overwhelmingly, these families do better when they were provided the abortion that they sought than the families who were denied the abortion. So it's called the Turnaway Study. It was done by, the primary author is Diana Green Foster. NPR just did a really nice review of it.
It's really amazing.
Will the pregnancy helpline report to the authorities? That's the question. I don't.
Or what?
Pregnancy?
If my guess is if someone
Oh my
seeks your
goodness.
concern,
Oh,
your
if they
care,
go- Okay.
and then you suspect that they got an abortion.
Sure. If you had like your retreat and somebody had an abortion, will the pregnancy helpline report that?
I mean, to my knowledge, there's no mandated reporting of such acts, so no. It's a very confidential program. We don't even advertise where we have our retreats because we want to respect everyone who has made that decision to come.
So there's a couple here for Dr. Jill. Will OBGYNs change their view on women getting their tubes tied? Most wouldn't do it if you were too young or if you didn't have like 2 or more kids.
So the state of Wisconsin requires that you be at least 21 years of age to have your tubes tied. That's the law. And that's more, it's enforceable if you have Medicaid or Medicare as your primary insurance. But we sort of take that as the law across the board. You have to be over 21, but there is no stipulation for the number of children that you have, according to state law. You will find individual providers who will not provide tubal ligation services for humans with uteruses if they're not old enough, by whatever their standard definition of old enough is, or have enough children, whatever their personal definition of their own children. You always have the right to seek a second opinion. So if you want your tubes tied and your provider says no because you're not old enough and you don't have enough children, like you're their child and not their patient, then you should say thank you very much and find someone else who will do it.
Hold the mic. Has your office received an inflection of women seeking tubal ligation since the ruling?
I would say we've been seeing more tubal ligation requests in general, even before the ruling. But since the leaked opinion, I wouldn't say I've seen more. But I am seeing more and more young people with uteruses seeking tubal ligations of late. But I also think it's just because it's become more out in the community, right? This idea that you had to be old enough and have enough children was very pervasive for a very long time. And so I think it's starting to we do it for one person, and so then she tells her friends, right? And then they start coming. So it's like a word of mouth referral. So yes and no. Is the short answer.
Carissa, there's 2 questions here for you. Do you plan to ramp up to serve more women who will now need services?
Well, we would guess that more women would need our services, but it's just a guess. And in order to provide more services, that would include having more donors. We gave out over 70,000 diapers last year, so if we're utilized more, we're gonna need more individual donors to help out with that, so.
How far do your services currently reach? Like, what's your territory?
Oh, Rock County.
Do you have plans to expand currently?
We don't want to turn anybody away, so currently, we receive a lot of donations from churches and individuals. We have not reached out to all the churches, and we haven't had to, because what we've received so far has been ample for the people that we've served. But we would definitely do more outreach, if need be.
This next question I want to kind of hear from each one of you. The reality is, this is where we are. How do you view healthcare services changing for women in our current situation?
Drastically.
And how so?
I mean, this is a fundamental shift in how we treat people with uteruses. Like, Dr. Jill, thank you so much for referring to individuals that way, because we know it's not just individuals that identify as women. To not have the autonomy, to not have the full evidence-based science and healthcare available to you, I can't even begin to imagine what that is going to look like in terms of us seeking healthcare. Because now, you know, I've been able all these years to go and know that my licensed healthcare professional would give me all my options and counsel me in a way that is in line with the science and my faith, my family. And I can't even, it's transforming the way we provide healthcare. And I do think there's going to be a new demand. I have my IUD in right now, and it's going to stay in because I can't afford another pregnancy, and I don't want to risk another stroke. And it's $900 a month for those shots that I got to give myself every day. I need my IUD in. And so I do think there's going to be, especially before they start tinkering with contraception access, there's going to be a need for that. But there's also going to be a need of social services. So this idea that, you know, you can just go grab diapers here, well, what about housing? What about employment? What about childcare? What about paid leave? What about, you know, a living wage? We have to step up and look beyond inside the clinic doors and look at the ripple effect that's going to happen in society. So when you're talking about seeking healthcare services, this is so far beyond clinical healthcare services.
And again, just speaking as the director of a helpline, we're not medical, so I feel ill-equipped to answer that question.
So immediately last Friday, when the Supreme Court decision came down, 7 states resulted in an abortion ban immediately, including Wisconsin. 2 other states are trying very hard. They have a ban, but it was blocked by their Supreme Court. They're going back. They're going to fix that. They'll get it banned too. 10 states will have severe restrictions, and 11 are very, very threatened. So it's about 30 of our 50 states. Abortion will be illegal, affecting 39.9 million reproductive age humans with uteruses. But interestingly, this ban is not going to have that big of effect. They estimated it will only reduce about 13% of abortions because women, well-resourced women, will be able to travel. Tech-savvy women will be able to get their abortion pills online. And a large number of women will seek to end their pregnancy on their own in any way that they can. So this ban is not a ban on abortion, because abortion is going to continue to happen at nearly the same rate that it was happening 8 days ago. Exactly. It is going to be far more dangerous for women to get the care that they need.
Sorry, I'll just add. We all know mental health is a huge issue right now. I think about these women or these individuals being forced to carry a pregnancy to term and how traumatic that is. And so we always talk about, well, there's the option of adoption. My sister has struggled with infertility, has entertained adoption, and realized it is completely unaffordable. So what are we going to do, right? Like, one, what are we going to do to make, there's going to be probably a lot more babies put up for adoption, and how are we going to make that feasible for families that want to seek that option? 2, it's been mentioned that there's this retreat and this therapy for individuals who regret their abortion. What about the mental health and the trauma of being forced to carry a pregnancy, knowing that you have to give that child up, or that you are now being faced with the consequences of that?
Yes.
So maybe the Rachel's Vineyard will start offering retreats for those individuals who have gone through the trauma of a forced pregnancy.
Yes.
Although we can't ask the pregnancy helpline, who has a completely different mission, to do that. And so in honoring the services that you provide, we do understand that it's going to be a necessity. And you keep hitting on the mental health aspect of this, and I'm so glad you brought up the adoption, because long before this ruling came down, every single person I've met that wants to adopt, it's usually a matter of income. It's not their ability to be great parents to a little one. It's their ability to afford it.
And 24 in 100,000 of them will die, who are going to continue their pregnancy to offer it up for adoption. 24 out of 100,000 of them will die as a result of carrying that pregnancy. In this country, in our current situation.
Which I don't know which side you stand on, but that's unacceptable on both.
Can I make a comment? I found out something recently. A friend is adopting a child that she's been fostering, and I said, how much will the adoption cost? It'll cost her $25 for a new birth certificate. So if anyone is wanting to adopt, if they have a heart for foster care, just think about that.
Yeah, one of my closest friends just was fostering for 6 years. They finally finalized an adoption. So, but 6 years of having that foster child put back in and out. So it's a little bit more complicated than that, but it's a very good point that foster care is an avenue to potential adoption. Greg, did you have a comment?
To go along with that, we have very close friends who fostered a child for many, many, many years and decided to adopt, and it cost them about $20,000 to do that. It was 10 for the first court hearing, and then it kept going up after that as the hearings came. So again, that had to do with they were fostering a child from Wisconsin and they lived in Illinois. But that's not $25, that's $20,000.
Well, and you're assuming then that child has to go into foster care first before it can then be placed in a foster home and adopted.
Right.
Which, wouldn't it be nice if they could get adopted right off the bat?
Right.
If it wasn't $35,000 that my sister can't afford.
In America, we can and should do better, no doubt, no matter what side. That's a topic. I'm glad you brought it up, because it's not something that we might have thought about in this venue. Speaking of the tech-savvy people, I did read an article recently that leads to this question, which, there's health tracking apps that we use very frequently to track our steps, to track our heartbeat, to track our
Menstrual
rhythms.
cycle.
And this one says, do you have any recommendations for period tracking apps that do not sell user data? I mean,
taking it off.
yeah, so who?
Taking it off now.
Yeah, so who would have thought of that? That's a big deal to someone who is childbearing years, and you started with technology. You were born with technology in your hand. You could run an iPad better than us before you could crawl, and now you're having to know whether or not these apps are being sold and going to be used against you. And so let's hope that there's some public policy lawyers that are going to address that. Are there any other questions in the audience right now? Or anybody that wants to stand up and ask a question within our boundaries? Okay, here's one here. Out of curiosity, how much money does it cost to go through labor in a hospital versus adopting a child? Again, might be a little passive aggressive,
With
but
insurance
let's see.
Depends if you have insurance.
Right. Healthcare companies are notorious for being very unclear about their costs. I think I read somewhere that the cost of a pregnancy, depending on where you live and who your provider is somewhere between $7,000 and $15,000 for the prenatal care, labor and delivery, your 6-week postpartum check.
Out of pocket or total?
So that's just like, that would be like the cost, like if you were gonna pay out of pocket. Friends of ours recently adopted children, and it cost them $30,000 a child and 6 years between each one. Actively trying for adoption for 6 years between each one. I have taken care of many women who have offered their baby up for adoption. I have never seen women struggle so hard in my whole life. And I've seen more change their mind than go through with it. And that offer as an option or a viable alternative to abortion is laughable. It's honorable. It is the greatest gift you could ever give someone. A couple who is unable to have their own children, to be able to offer your baby for adoption to them is an unbelievable gift. But it is too much to ask of anyone.
Not to mention whether or not this will revert us back to the 40s and 50s of the orphanages in the South that literally engaged in baby selling with unwanted pregnancies.
Or in many underdeveloped countries throughout the world, that has happened up until very, very recently. And maybe in some places still is, especially among indigenous populations.
Yeah. All right. This is obviously not about babies. If it were truly about babies, there would be no children living in poverty. This is clearly about power, social status. If a woman has money, she will be able to get an abortion. We need to look at the bigger picture, and we need to ask questions. Why would our government want more women in poverty to give birth? This situation keeps the women in poverty and keeps their children in poverty, and why? So, great feedback. Not sure that it's a question that we can answer. Okay, any more cards in the audience before I? If you raise your hand, just please remember the rules. One question here. Okay. And please speak loud enough to be heard in the back.
So a group of us want to do something. What are your top 3 recommendations for things we can do in this atmosphere to educate, to change policies, and to support?
Well, I got that one.
Okay.
Can you repeat the question? We couldn't hear it.
The question was basically like, what do we do now? What are the top three things we can do now if you're not happy with what's happening? Number one, I put little cards out on the table. We need to make sure that we are sharing trusted, reliable reference information for individuals still seeking abortion. So there's little square cards that were out on the table, and I can make those multiple, but there's hotlines. Put it into your cell phones. There's hotlines around self-managed abortion. There's abortionfinder.org. We still need to make sure we connect individuals in need to the care they deserve. So one, make sure that you're using that trusted information. Two, I would say make sure to donate to those organizations like the Women's Medical Fund and others that are going to be there to help these individuals connect to the resources they need, whatever it may be. And three, please don't take a single election for granted. We are here today because of the 2010 midterm. And we have elections coming up on August 9th, where the primary elections will be there. And we have election on November 8th that will tell the future of our state for a generation. 2010 and what has come with it in terms of redistricting and in terms of voter suppression has already insulated power in a way that, as a women's health advocate, it is impossible for me to advance a piece of legislation that is there to help improve women's health, safety, and economic security in this state. It is impossible right now. And it could only get worse on November 9th. We cannot make the same mistake we did in 2010 and think, oh, you know, we showed up in the 2020 election and we showed up in the 28 election. School boards now, you talk about sex ed, school boards, county boards, public health, sheriffs, district attorneys. Pay attention to every single one of those, because there is another side to society right now who is using every single one of those offices to move this extreme agenda along. And if we don't pay attention, if we don't start becoming one of that 7% and grow that amount of people who know there's a website called whorepresentsme.info. And you can find out every single person that represents you. And if you put your favorite bakery and salon in your phone, put your legislators and your representatives in your phone, right? And start recognizing that right here, right now, are you okay having all of these systems and policy change happening to you? Or do you want it happening with you? Because that's democracy, is with us. But we have to figure out how to remove those barriers and get off the sidelines of democracy and make sure we don't take a single opportunity to exercise our voice, our values, our vision, or our power for granted.
Carissa, did you want to, now, you know, clearly you're going to have people calling your helpline. It's going to ring more often now. And so what are the things that the people in this room can do to help in that situation?
We're always looking for volunteers, so if you're someone in this room who is an advocate for life, faith, and family, please seek us out. We would love to have you. We would love you to join our group. We truly believe that women facing challenging and unexpected pregnancies deserve to be treated with the support and respect and life-affirming care. And if you're on board with that, we would love to have you.
For the record, who here is anti-life? Stop calling it pro-life.
What are the rules of engagement?
If you're pro-life, you're supportive for other things.
So there are definitions, and I think that is one of the hard topics that happens, right, when we're watching the news and you hear pro-life, pro-choice. There's not a single individual in this room that is anti-life. We all have our own circumstances and lens in which we see things through, and our passion oozes out of us. There's nothing that, as you're talking about elections, that is my career. And so, secretly on the inside I was doing backflips, and I don't know how well I contained myself, but there's multiple sides to this, and I was holding off till the end to talk about what do we do here, because it's 2022 and here we are. I'm going to get to my page here because this is the reality. We have a lot of political division in our country, and this topic has, from its origination, been a topic that causes political division. We have a very different Supreme Court. We have so much more, even than in the 1985 law, but I'm talking about 1849. We have science, evidence, and fact with access to more information than ever. We have an ability to share our religious values quicker and easier than I ever imagined. Until COVID hit, I never thought that I could watch 27 ELCA Lutheran services at the same time on Zoom. We have more regulation and more government in some issues, and less regulation and less government on other issues. And it seems like the balance is shifting. Our other women's rights, and I know there are men in the room, and I just can't thank you all enough for braving your path to be here tonight. Because in every single pregnancy in my short 54 years of life, it takes two to make that happen. So thank you for being here. But are there other women's rights that are on the line and at risk? And the question becomes, and I saved all these because a lot of you were saying, what do we do? What do we do? You contact your legislators and you share your perspective, and they don't want to be recognized tonight, I know, but there are current legislators, there are retired legislators, and there are people on your ballot in this room right now who are interested and engaged in the past that they have laid, the current on where they are and where they want to go. And once a politician, always a politician. I've never met somebody that, I've got Tim Cullen in the back, he raised his hand, that means that I can say hello to you. Would you like to say something, Tim? Please do.
I just hope that, not just this room, but I hope 1 million more people in Wisconsin understand the consequences of an issue called gerrymandering. Gerrymandering of itself is not a visceral issue, but it affects every other visceral issue, and now this is maybe the visceral about visceral issues. And it doesn't have to stay the way it is in Wisconsin. There is no requirement that the legislature only reapporting just after the census and then not again for 10 more years. You can reapportion every year if you want it. And we have a Supreme Court race next year, state Supreme Court race, which will be a factor as well. So it was just so hard to convince people that gerrymandering really mattered. It was just some of those people mad us to do every 10 years, so what? So what? God is where we are today.
Tim Cullen.
Tim, thank you. People ask me all the time, Sarah, what is the #1 threat to women's health in Wisconsin? Gerrymandering. Because nothing can get done while there is a skewed, manipulated democracy in our capital where they have insulated power based on drawing their own districts and picking their own constituents. So here you have, again, less than 7% of people knowing who the legislators are, and then how do you hold them accountable when they've drawn the districts so tightly that there's impossible to challenge them from another party? Absolutely. Tim, that's the biggest takeaway right now, is that we can't reverse the 1849. We can't repeal the 1849 law. We can't pass paid leave. We can't do any of that until we get fair maps, fair elections, and a fair count in the census.
Yep. So this is the case, right? Contact your legislators and share your perspective. Please do not let these voices in your head, because I get them too. Oh, they've already made up their mind. They've got a special letter behind their name. That's not necessarily true. I serve to a local city council, and I can tell you that your voices change their mind. I have served at a county level where the county board of 29 supervisors have writhed over community issues. I mean, we're talking like whether or not to put a yield sign up. It's not as important as this. But at the state level, I just never ever want anybody in this room to think that, oh, it's not going to matter. My voice won't matter. Because that's just not true. And when we sit on the sidelines, it gives people power. If they just literally, you sit on the sidelines, they're taking power that you don't know you gave away. Regardless of your side, I'm talking to every one of you in the room. When you sit on the sidelines, with election turnouts in April at 13% of registered voters, so that knocks us down to 6% of eligible voters coming out to elect your local politicians. They're nonpartisan, but they still have to set policy. We are lucky to get 35% in an August primary. So that means 70% of the registered voters are going to stay home and let somebody else pick the persons that's going to land on the November ballot. We have to put up with 7 months of network television commercials hating on each other to sit home in August? Please don't think that your voice doesn't count, because it does. And then there's this local organization situation. I mean, we have two right here. Pretty local organizations that you can reach out to, you can volunteer. What can I do? I mean, you can stuff envelopes, you can make calls, you can answer phones, there is so much that you can do in a local organization with a minimal time commitment. So in most of these, I would imagine, you can open up your checkbook as little or as far as you want. You can donate as little or as many hours as you want. I will let you know if you have any health care background at all, we have a free medical clinic where the Mercy doctors go down and volunteer their time, so we could do the same. Advocacy groups. We have lots of advocacy groups in this room. I'm looking at the name tags, seeing the YWCA and the League of Women Voters. We've got the University Women for allowing us to use their facility and standing up. Any advocacy group that is going to fill your belief set. So, and maybe it's a matter of having more conversations like this, where we listen, we ask valid questions, we don't get angry, and we try to meet somewhere in the middle, right? Because everybody's so far apart right now that if we don't meet in the middle, pretty soon I think we're going to implode as a country.
The idea of reaching out to advocacy organizations, I mean, I get to do this for a living, but there are so many people that sit at home and think, where do I even begin? What does it even matter? We always talk about this policy-making kitchen and finding your way to it. People think, I have to be a sous chef if I go into that policy-making kitchen, right? Like I have to be an expert. I have to have all my data and all my facts in line, and that's just not true. I'm not a good cook. My kids will tell you that. But there's a place in that policy-making kitchen to fold the napkins, pour the wine, taste the food, right? Like there's a role for all of us to play. And I just want to offer that there are a lot of organizations that are really recognizing the power of centering the voices of individuals in policy and systems change. And organizations like ours, I've started referring to us as an advocacy doula organization. So if you know a birth doula, right, someone's there to help you through what can be a very scary and foreign thing of being pregnant and having deliver a baby. And we get the same kind of pushback when it comes to policy. Ew, like I'm scared of policy, I'm intimidated of policy, I don't even know where to begin. So organizations like ours are here to meet you where you're at and recognize there's a menu of ways to make a difference. So if anybody does want to reach out to our organization, we very much want to serve as an advocacy doula to anybody that's looking to get off those sidelines in any way.
Did you have a question or a comment?
A comment.
Go ahead.
I would be remiss if I didn't point out that there's more to this than policy. This is the situation that we are in right now, whether you are happy about it or crying. So reach out to those organizations that are providing the services to the women who are going to be in crisis. Policy change is in the future. We have women in crisis right now. Please don't forget that as you continue to fight for a change that won't help them today.
So here we are, right? What can we do? You took a first step by coming here tonight and being willing to listen. I want to give you the mic one more time, and I'd love if each of you would just make some closing remarks about why you agreed to be on this panel, knowing that hard questions were going to come to you, and knowing, right, the people we attract here are, tend to be some pretty strong-minded women. So what you can empower us with is some of your last words of wisdom, and if we missed anything on the to-do list, give us that as well.
I don't even know where to begin, honestly. This law is dangerous. It is reckless. And the loss of the right to make decisions about your own body is unbelievable and frightening. Women seek options for their own self-preservation. It is always out of a place of self-preservation that they make these decisions in the moment. And for now and forever, we should all be able to choose our own self-preservation at any given moment. And so I encourage you to fight with your vote and to fight with your checkbook for both the policy advocacy going forward, but also the women who are in the fight right now. There are lots of organizations. Sarah provided us with several. I'd like to mention one more. The National Network of Abortion Funds is a direct funding to patients who are seeking care in this very moment and who are being denied that care because of state legislatures.
I'm gonna let the panel.
Oh, the national, which one?
I just wanted you to restate that so we can make sure and make a note of it.
The National Network of Abortion Funds.
Thank you.
As you can imagine, I was pretty nervous about coming here tonight, but I really wanted to come to share what we're doing at the Helpline. It's my life mission to help women who are in crisis pregnancy, because I was there and I made some choices that I'm not too happy about. So if I can help a woman who might think she has no other choice, I'd like to be there for her and for him and for the families. So we're not perfect over there at the Pregnancy Helpline, but we're trying to help families. We really are. And we're trying to provide truth and support. And I really, really appreciate this opportunity to come and talk to you.
I'd like to say something real quick. I'm here as a trans man who has a uterus, and I would like to remind everybody that women are not the only one who have reproductive organs that females typically have. They're intersex people, they're non-binary people, they're trans men like me, my friend over there. So let's be a little more inclusive, please. Just like to put that out there.
Thank you for sharing.
Thank you very much. I'm honored to be here tonight. I appreciate all of you showing up. That's the first step, right? Showing up, and then recognizing if you don't speak up, you can't be heard. So I hope you can connect to each other, connect to the community, go forth and echo this conversation here tonight. And it doesn't have to be this way, and I know this was not a happy-go-lucky conversation tonight. So hold true to what you know is injustice in this world. And I have to just say before I have it on my notes, in the beginning, Laura, you were talking about like, I'm a good, Christian person and I value life. Again, anybody here who's Christian doesn't mean that there's a certain way of approaching life, right? So like 75% if higher oppose what just happened in this country, right? Like, so don't self-judge yourself if you're feeling like there's an injustice and you're like starting to learn more tonight. Good Christian people are also pro-choice.
And that's the reminder that we need. I mean, it's in how we say it. It's in how we, we're seeing life through our lens. And so knowing people from different walks of life and different choices that are made, I really am glad you stood up for that, because there's a lot of people in this room that are from different generations, and we need to understand. And that is one thing that I wanted to say was, somebody asked a question, how can we get our younger generation to act on this? And, I just would say, just be a light. Be a light to the younger generation. Embrace, understand, seek to understand. There's a lot that we don't understand about this situation. And, coming here is the first step to doing that. So, thank you again to all of you who came, but also to our host, AAUW, Diversity Action Team of Rock County, League of Women Voters, and the YWCA of Rock County. To the panel, and yes, I did drop it down to Dr. Jill because I just thought you were that cool, and I wasn't going to ruin your name any more than I did. Carissa, thank you for your grace in throwing that completely awkward question your way. Sarah, thank you for your passion and for being here. You are the reason why this conversation started in the first place, because a group of us were down in Beloit at the Women's Fund luncheon celebration where you spoke on one of the days where, and I believe it was actually the day that the Supreme Court decision had been leaked, and we were told, you can't talk about this. We were at a women's organization, and you can't talk about this, and that was hard on us. We said, well, we have to talk about this. So, her passion bubbles over, but we're here because that passion bubbled over, and we had to do something extra. So, my final thank you goes out to JATV, who has recorded this conversation. The beauty of having this kind of technology is we will have a video that we'll be able to share, and we'll be able to expand on what was shared tonight and the things that we learned. I hope you learned as much as I did. Have a very safe and wonderful 4th of July, and I hope that you find out who your representatives are on this weekend of freedom and write some letters. Safe weekend, everybody.